there. Here with, hey there, here with the amazing Dr. Gregg, who invented the whole procedure of the LANAP and the laser to go along with it. And as you may know, I had laser gum surgery. I'm a week out from having both sides treated now. Just had my follow-up, and how did it look?
Look great. Really fantastic. No tissue was removed. There's no recession. There's no spaces between the teeth. It looks pink and healthy. We know that the bone underneath is going to continue to remodel and regenerate over actually years, but it will be a unaware experience for you. You won't know that that's going on any more than you would know when a broken bone in your arm or your leg would be healing over time. So it's one of those phenomenons we're trying to understand why the bone continues to heal over years and get better and more dense.
It's an amazing procedure. You need to check it out. You know that 85% of the U.S. population has some sort of gum disease. So I didn't know this was an option myself until literally started having a tooth bleed while I was working out profusely. Went to the dentist. They told me I was going to have all this surgery, $12,000, $13,000 in surgery, take a year and a half, bone grafting, all kinds of stuff. And then I found out about LANAP, and it literally cut my costs more than in half, and no surgery, no massive evasive surgery. They're going to hack me up. It's a very delicate procedure. Literally very little, if no pain at all. The downtimes are minimal, and I could not be happier with the results thus far. And seeing some of the other patients that Dr. Gregg and his staff and some of the other physicians around the country that have treated these people, and I'm looking at the before and afters and the video testimonials, and I'm a mild case, but for some people that have gone 20 years without seeing a dentist, and you can imagine, but seeing the before and afters, and not just after post-surgery, but 3 years, 5 years, 15 years out, the amount of bone growth and how the gums remain healthy as long as you take care of them. Normally. You don't have to go above and beyond and do anything crazy. It's phenomenal. And so for me, the important thing is to let people know that this is an option out there. This is the laser. This is the tool. And you truly don't even feel it when they're actually doing the surgery at all. So I just want people to know that LANAP, LANAP, check it out at lanap.com. It's a procedure that is available for anyone with gum disease, and for me it saved me from going under the knife and doing some pretty gnarly stuff to my mouth that did not, it wasn't my A option, put it that way. But your teeth are very important to your long-term health. As you know, health is what I'm all about, and so for me it was something I needed to address. It's definitely something that I needed to get in check before it got out of hand for my own health. And so I encourage you to check out LANAP, check out Dr. Gregg if you're in the Southern California area, and if you're not, definitely go online or contact the office and find out what dentists are in your area that actually offer this procedure, because it's far superior than anything else that I've found out there.
I think your followers would really like to know, were you able to keep up your workout regimen immediately post-operative?
Well, I only missed one day, and that was the day of the surgery, per your advice and your staff's advice. They said, take it easy for the rest of the day. But other than that, the very next day, after I hit it again pretty hard in the gym, and no problems, no worries, no bleeding, no anything like that, no severe pain. So it was fine. I got right back into it without skipping a beat.
And for anyone who's ever had that experience or know anyone that's had conventional gum surgery, they know that that's not the reports that they would share or experience. It would be, wow, many days off, maybe some breakthrough bleeding, maybe some post-op infections or pain. It can be, days or even weeks before they're back to their normal routine. But we just advise that the first day, just take it easy, let your body, recover, and then pretty much you're back to work the next day without any consequences in terms of compromising the healing process. And just like to add, there's no sutures, so we don't need to. The laser seals the tissue in this protocol, so I think that's also important. And you don't get a gummy smile, you don't get holes between your teeth, you don't have teeth that look like pure pylons at low tide.
They still look good. There's,
Yeah.
no major gaps.
Yeah. And TJ was an awesome patient. You know, being in good health certainly helps the outcome. Being in good overall health certainly helps the recovery process. Although we've had, you know, physically and compromised patients, people with systemic diseases besides just gum disease, and they do quite well. And they're surprised at how much energy they get back, because I think there's something to the idea that light creates and energizes tissues. And we see that in the mouth, but we can also see it in the body. It's hard to detect it off of TJ because he's already energized.
Well, I will say this, anytime you have an infection in your body, and a lot of times when you have gum disease, there's an infection under there somewhere. Obviously, if your body's spending energy trying to fight that infection, of course, you're not going to feel 110%. And you might not even realize it because it might be a nagging issue that you've had for years. And so for me, I was very conscious of it. Once I became aware of the issue, it's something I need to get zapped out of me right away. And to find out that this procedure actually also kills that infection and preserves the tooth and helps regrow bone and all the things that I really needed all in one, to me it was a no-brainer. So thank you, Doc. I truly appreciate you, man, very much. And guy's a genius. So not many people actually have contributed to society in such a way, but this guy invented this whole procedure and patented it. But he's got a great facility here where he actually teaches dentists and doctors from around the country and around the world to actually bring them up to speed on how to utilize this. And so, again, check out LANAP.com, find a surgeon in your area, and you'll be surprised at the results. I promise you that. So thanks again, Doc.
Thank you very much.
Yeah.